Chronic ischemic heart disease now covers a wide range of pathological conditions, from obstructive atherosclerosis to microcirculation disorders, endothelial dysfunction. The probability of obstructive lesion is now calculated individually taking into account age, gender, symptoms, and risk factors. At an average probability, 5 to 50%. Non-invasive coronary angiography by means of computed tomography is recommended first. At a higher probability, functional imaging. Intensive risk reduction. Priority is given to the control of arterial hypertension, lipid metabolism, diabetes, smoking cessation, and weight loss. Lifestyle changes are at the heart of the approach. Symptomatic treatment remains the basis. Antithrombotic therapy. Lifelong administration of low-dose acetyl salicylic acid remains the standard. Clopidogrel is an alternative in case of acetyl salicylic acid intolerance. Dual antiplatelet therapy after stenting is recommended for up to 6 months, and shorter if there is a high risk of bleeding. Percutaneous interventions or coronary artery bypass grafting are performed only if drug therapy is ineffective or there is significant ischemia according to imaging data. The decision should be made by a multidisciplinary team, taking into account clinical recommendations and patient preferences. The patient will be treated with the principles of personalized medicine. Diagnostics and treatment are selected individually, based on the patient's characteristics, and not according to a universal scheme. Doctors work systematically, taking into account not only large vessels, but also the state of microcirculation, inflammation, metabolic, and functional aspects. The patient expects a step-by-step approach. From screening and non-invasive diagnostics, to drug treatment, and then, if necessary, to intervention. Medicines, both proven and new, are prescribed only if there is convincing evidence of effectiveness. One of our patients is from Kazakhstan, 58 years old, overweight, but without diabetes. Non-smoker. At his place of residence, he has long been taking nitroglycerin spray for chest pain that occurs despite taking pills. The man came to us because pain behind the sternum when walking quickly and climbing stairs began to appear every day. He noted fatigue, decreased tolerance of any physical activity. The presence of hypertension was known, but the patient did not measure his blood pressure regularly. He had no previous heart attack. Upon arrival, an individual risk assessment was performed. Based on the diagnostic results, the consultation decided on a multi-stage approach. Specialists recommended drug therapy and interventional intervention. Coronary angiography was performed through an access on the wrist. With the installation of a stent with a drug coating in the anterior interventricular branch, the procedure was successful. Without complications. The patient underwent 2 weeks of cardiac rehabilitation in a specialized clinic. During his stay in the clinic, the patient received individual recommendations on nutrition, physical activity, and blood pressure control. As a result, the patient's angina pains behind the breastbone completely disappeared. He began to calmly endure everyday stress and regularly engages in physical activity in accordance with the clinic's recommendations.